Welcome to the BAGC seminar program. I'm Deepak Ghosh, coordinator for the BAGC seminar programs. Our topic for seminar tonight is causes, prevention, and management of diabetes and prediabetes. We used to do this kind of seminars live at our Bango Bhavan building, but since COVID-19 forced us to go virtually, we are coming to you virtually for this seminar. The importance of this subject is enormous. 1 in 3 person in USA has pre-diabetes. And if you add the diabetes on top of it, it's about 120 million people in the United States having this issue of diabetes and prediabetes. And the number is even worse for Southeast Asian population, particularly Asian Indian community. We have a serious problem with this issue with our community. This is an outstanding informational seminar for all of us. We had this seminar in 2019 at Bango Bhavan in front of small group of BAGC senior members. Now we are bringing this to the entire BAGC population, so all of us can get benefited from the information that our speaker is going to share. Our speaker tonight is Julie Sanfillippo. Julie is a registered dietitian with Edward-Elmhurst Hospital. She's a graduate of University of Illinois at Urbana-Champaign. Currently, Julie is a lifestyle coach for the Jumpstart Your Health diabetes prevention program at Elmhurst Hospital. BAGC members, it's my distinct honor and privilege to invite Julie Sanfillippo to BAGC. Julie, please.
Thank you, Deepak. Thank you for having me. I'm glad to be back. So as Deepak mentioned, my name is Julie and I am a dietitian. I work at hospital, and I am a lifestyle coach for diabetes prevention programs at the hospital called Jumpstart Your Health. We'll get into more of that later tonight to have a greater understanding. So today's program, we're talking about what is diabetes, what is prediabetes, are you at risk, what is the Jumpstart Your Health program, and what are some things that you can do? What are some take-home messages that you can implement into your lifestyle right now to help you prevent diabetes? So what is diabetes? So simply put, diabetes means there's too much sugar in the blood. We know over time that people with uncontrolled diabetes suffer from a multitude of issues that can affect every system in the body, from heart attacks to stroke to kidney failure to blindness. So we know that it affects almost every system in the body, but we also know that a lot of diabetes cases can be prevented. Other reasons you want to avoid diabetes is because it's a very burdensome disease. So it's an expensive disease. There's a lot of supplies, medication, testing strips, meters. It takes a lot of time to balance your diet with exercise and medications, the doctor's appointments, seeing the diabetes educators. There's a lot involved in managing diabetes. So that's a whole nother reason, besides the health implications, that we want to prevent this chronic disease. So what are the risk factors for diabetes? So you'll see on this slide, a lot of the risk factors are listed. And as you look at some of them, you'll notice that some are not avoidable or preventable. So for example, certain races and ethnicities are at a greater risk for diabetes. We can't do anything about that. Age, as we age and get older, our risk for diabetes goes up. Our family history. So if our mother, father, sister, or brother had diabetes, that's going to put us at risk later in life. These are some examples of risk factors that are not modifiable. But you'll notice that there are a few things on here we have control over. One of those things being our activity and the other being our weight. And we call these the lifestyle risk factors. And we know that these two risk factors are the greatest determinants for developing diabetes. Deepak mentioned earlier that diabetes affects certain races and ethnicities greater than others. And just for example, 60% of people with diabetes across the world live in Asia. So that is a huge number. And this is why it's so important that we talk about this. So if we're looking at diabetes in the USA, I'm going to show you some pictures of the map of the United States. And starting in 1994, you'll see that the colors that are in the darker orange represent states that have a higher incidence of diabetes. And as the years progress to 95, and as I move on here to 96, you'll see the states get darker and darker in color. Now we're seeing a dark maroon, we're seeing a bright red. And if I keep scrolling all the way to our most recent data in 2015, you'll see that more than half of the states are this dark maroon color, which means more than 7% of the population in these states have diabetes. And what you'll also notice is that very pale yellow color that started out in 1997 is no longer represented on this map. All of the states have had an increase in diabetes. And the sad thing is we're seeing type 2 diabetes even in children. So some of the statistics, 30 million people have diabetes. 23 million are diagnosed, and the scary part is 7 million Americans are walking around undiagnosed with type 2 diabetes. They don't know that they have it. Typically, type 2 diabetes accounts for most of our diabetes cases in our country, 90 to 95%. Type 1 diabetes is an autoimmune disease. It's not a lifestyle disease, and that accounts for a small percentage of the diabetes in the country. And we know that diabetes is higher among Asian Americans, African Americans, Hispanic Americans, and Pacific Islanders. So how can we prevent getting this chronic disease? So we know that there's a condition called prediabetes. And prediabetes is when your blood sugars start running higher than normal, but it's not high enough to be diagnosed as diabetes. Prediabetes is a recognized syndrome. There's 86 million Americans that have this. That's like 1 out of 3 adults is walking around with prediabetes. The problem with this syndrome is that 90% of people who have it don't know that they have it. There's not a lot of really overt signs and symptoms that you would have prediabetes. You would really only know if you had blood work done with your physician. Some of the risk factors for developing prediabetes include being over the age of 45, being overweight, a family history of diabetes, being active less than 3 times a week, and any woman who had gestational diabetes during pregnancy is at a greater risk for prediabetes. So we do have some diagnostic criteria that can help physicians determine whether or not their patients have prediabetes. And one of the tests is the hemoglobin A1C. I'm starting with the fasting glucose. The fasting glucose test measures the amount of sugar in your blood at the time the test is taken. Most people have had this done before. This is the test where your doctor will advise you to fast overnight and have your blood work done first thing in the morning. And part of the metabolic panel comes a fasting glucose. A normal is less than 100. Diabetes is considered greater than 126, and prediabetes is somewhere in the range between 100 to 125. So if you had a fasting glucose and your number was 110, that would indicate that you're running higher than normal, there's some insulin resistance going on, and that would put you at a prediabetes range. The next test is the hemoglobin A1C. This test is useful because this measures your average glucose over the last 2 to 3 months. So this test gives us a little bit of a history of what's been going on. This test is measured in a percent, and the ranges on the bottom show us that less than 5.7 is normal, 5.7 to 6.4 is prediabetes, and greater than 6.5 is diabetes. The A1C is not a routinely drawn test with a physician. Typically, there has to be some risk factors that would warrant this test, but it is something, if you have a strong family history and some risk factors, it is something that you would want your doctor to run for you. So somebody with prediabetes who has somewhat higher normal blood sugars is still at risk of other conditions like diabetes, heart disease, and stroke. So prediabetes is not just an innocent syndrome where we're walking around with slightly elevated blood sugars. It still puts us at risk for some other issues with our health. We also know that without intervention, 15 to 30% of people with prediabetes will develop type 2 within the next 5 years. So what have we learned about this syndrome over the years? Well, there was a major clinical research study that was done in the 90s, and it took people who had prediabetes and it separated them into 3 groups: a placebo group, a group that took metformin, which is a diabetes medication, and a group that participated in a lifestyle change program and worked on weight loss and increased activity. Over 3,000 people participated in the study, and the results found that those who were part of the lifestyle change program and reduced their weight and increased their activity reduced their risk of developing diabetes by 58%. And those that were over the age of 60, their risk went down by 71%. So even more effective for those over the age of 60. The group taking metformin, or the diabetes medication, their risk went down, but by only 31%. So this research showed us that lifestyle change was almost twice as effective than medication for preventing diabetes without any side effects. So the results of this research were very compelling. They ended the study early. The study lasted about 3 years. They ended it early because the research and the results were so solid that they ended the study so that they can now offer these lifestyle change programs all throughout the country. And that's exactly what Jumpstart Your Health is. It's a diabetes prevention program that's adapted from the diabetes prevention research study that I just reviewed. So how much weight did these participants lose and how active were they? They lost about 5 to 7% of their starting weight. So for example, if somebody started the program at 200 pounds, they would need to lose between 10 to 14 pounds to see diabetes prevention benefits. And also they had to increase their activity to 150 minutes per week. Those were the 2 key factors identified in preventing diabetes. The most important detail of those 2 was the weight loss. The 5 to 7% weight loss was key. Without the weight loss, the results were not as compelling. So weight loss is a challenge, and we know this, especially with COVID and being home so much, not being able to go to our health clubs, maybe eating differently because we're working from home. Maybe we've put on some weight since the pandemic started. So we know that we have to maintain a healthy weight for overall good health and diabetes prevention. When we talk about losing weight, we have to remember that 1 pound of our body fat is about 3,500 calories. So in order to lose 1 pound, you would have to make 3,500 calories disappear from your diet in order to see the weight loss come off. So if we divide that 3,500 calories by 7 days in the week, that means every day we'd have to reduce 500 calories in order to see 1 pound loss per week. If you wanted to be more aggressive and lose 2 pounds a week, you would have to reduce your calories by 1,000 per day. So these are big numbers, and that's why losing weight can be difficult. We have to eliminate a lot of calories in order to see the weight come off. What's the best way to lose weight? The best way is to combine calorie restriction, so reducing what you eat, and burning calories with activity. That is the best way. And it sounds simple, but the problem is most people don't do both. They do one or the other. We have to have both pieces of the puzzle in place to see the progress and see the results that we want. If somebody was to exercise alone and not change their diet, they would not lose any weight. And sometimes that surprises people. They think as long as I exercise, I should lose weight. It's really not the case, because the amount of calories you burn during exercise isn't enough to offset the calories that we eat and how calorically dense our food is now. So for example, if you took a 30-minute brisk walk, an average 150-pound person might burn 120 calories doing a 30-minute walk. Well, then that same person might come home and have a 400-calorie bagel for breakfast. So you could see the amount of calories we take in are high, and the amount of calories we burn with activity is not as much. So trying to lose weight with exercise alone is almost impossible. We have to cut the calories from our diet. We know it's hard to do this. We know that it's hard to change old habits. We know that maybe there's some medical conditions that make it more difficult for people to exercise and be active. Maybe there's a lack of motivation, a lack of knowledge of what to eat and how to exercise. Maybe your stress levels are. There's a lot of research about stress hormones and how that interferes with our diabetes hormones and how that affects our blood sugars. How poor sleep also increases to heavier body weights, because again, lack of sleep interferes with our appetite regulating hormones. Sometimes our barriers is our schedule. We're too busy. It's not a priority. Maybe it's the weather. You know, when the seasons change in Chicago, maybe we stop exercising because we're inside. There's a lot of barriers that make it difficult to live a healthy lifestyle year round. The first thing we need to do, though, is we need to work on our nutrition. We need to cut the calories that we eat, and we have to make sure that the calories that we take in are the most nutritious as possible. So when we talk about our food recommendations and our guidelines for Americans, we used to have these pyramids. These pyramids were part of our dietary guidelines, but they didn't really prove to be beneficial for people, and they didn't really help people make good food choices. So in 2005, they eliminated the pyramids, and they came up with this balance your plate drawing. And on this picture, they wanted to show you on a plate how your portions should be represented when you make a plate of food. So that half of our plate is fruit and vegetables, a quarter of our plate is protein, a quarter of our plate is grains, and then a serving of dairy. This balance your plate is our food recommendations from the USDA. This is from our dietary guidelines for Americans. If you visit that website listed below the plate that says choosemyplate.gov, it's a really wonderful resource if you want more specific dietary guidelines and recommendations. You can enter your age, your gender, your height, and your weight, and it will generate how many servings from each food group you should aim for each day. And they have a nice resource of information that you can learn so much from. So this is where we're at today, is the balance your plate. I'm going to talk about each of these groups in a little bit more detail. The first thing we have to discuss is portions, because today, especially in our country, portions are very large and distorted. We forgot what portions should be. So when it comes to fruit, fruit is a great food for us. Fruit has a lot of nutrients, vitamins, and minerals. It has phytonutrients, which come from the pigment of the color of the fruit and vegetable. We get certain beneficial properties from the phytonutrients. And so we need fruit in our diet, but we can't eat unlimited amounts of fruit all throughout the day, because fruit has a natural sugar called fructose. And because of that fructose, we can't eat all the fruit that we want throughout the day. But what we can aim for is anywhere between 1 to 2 cups per day of fruit. So when we talk about fruit servings, you'll see listed here what is considered a cup of fruit. For example, 1 large banana, that's considered about 1 cup of fruit. The best way to eat fruit is to get fresh fruit or frozen fruit. We really like you to avoid, listed at the bottom, dried fruit, juice, and canned. Those are highly processed, they have added sugars, and any kind of juice, even 100% fruit juice, is already in the liquid form. So when you drink it, it's going to spike your blood sugars quickly and spike them high. It's always best for you to eat the fruit with the peel, with the fiber, and have that digestion take place so the release of that sugar is a little bit slower. On the other end, vegetables, we consider these free or unlimited. Vegetables are full of water, full of fiber, they're low in calories, they're low in carbohydrates. So nobody will gain weight from eating too many vegetables, of course, unless they're covered and smothered in butters and cheese. But vegetables, naturally, raw, cooked, are very, very low calorie. We want to try for at least 2 cups a day of vegetables, but again, they're free or unlimited. So if you wanted to eat 6 cups a day of vegetables, even better. We know that we need most of our diet to be plant-based. So really increasing our vegetable intake is one way to get that. Vegetables also give us a nice amount of dietary fiber. And again, foods with fiber digest more slowly. They don't spike your blood sugars as high or as fast. So with vegetables and fruits, you want to try to get a variety of colors. So when you're shopping, make sure your grocery cart is full of all the colors of the rainbow, the reds, the greens, the blues, because you're going to get those phytonutrients from all the different colors of the rainbow. Make your vegetables and fruits as easy to eat as the junk food. It's easy to grab a bag of chips. It's easy to open a candy bar. It's not easy to peel and cut a pineapple when it's time. So doing these things in advance really makes it a lot more conducive to choosing fruits and vegetables as snacks. Protein, or that purple section of the plate, should take up 1/4 of your plate. Most adults need about 6 ounces per day of lean protein, and that's really the key, is lean. There's all different types of meats and fish. We want to look for the lean ones, which is your skinless poultry, so taking the skin off of the turkey and chicken, flaky fish, salmon, lean ground beef, lean pork, pork tenderloin, center cut pork. Eggs are a great source of protein. You'll also get protein from cooked beans like lentils, chickpeas, pinto beans, and then you'll get a small amount of protein from peanut butter. So with protein, we want to work towards portion size, 6 ounces a day, and type of protein, getting those leaner cuts. The grain section is where we get into a little bit of trouble. We eat too much bread, we eat too much rice, we eat too much pasta. This is where the portions can get too much. Most adults need 5 to 8 ounces per day of grains. So with that, it goes back to portion control. That 1 ounce of grains is about 1/2 cup of cooked pasta or rice, or 1 slice of bread, or 1 6-inch tortilla. All of these items equal 1 ounce of grains, and most adults somewhere between 5 to 8. The other very important thing when choosing grains is that we try to get the whole grain. So that means the unrefined products. When you choose the whole grain, you get all the nutrients and all the fiber from the whole grain versus when it's stripped down. So that extra fiber, again, helps that food digest differently. It helps it digest and break down more slowly so that it doesn't spike your blood sugars as fast or as high. So always an advantage for you to choose brown rice, whole grain pasta, whole wheat breads. You're going to get that extra dietary fiber, and you're also going to get the benefit for your blood sugars. With dairy, adults need about 3 cups a day of milk, cheese, and yogurt. The only thing that we have to be careful of is dairy can be high in fat if you're having full fat cheese or full fat yogurt or whole milk. So we want to aim for like a 1% milk, low fat yogurt, reduced fat cheese, so that we can cut down the amount of fat in our dairy products. All of the fat in our dairy is also saturated fat because it comes from the animal. So that's another reason why we want to choose a low-fat dairy, is to decrease the saturated fat, which is that animal fat that can raise our cholesterol. Oils are not a food group, but oils and fats are an essential nutrient. So we do need some healthy fats in our diet, about 6 to 7 teaspoons a day of heart-healthy oils. Olive oil, canola oil, avocado oil, those are going to be your best choices. And you really want to limit butters and shortenings. And just, again, be very conscious of portions, because 1 tablespoon of oil or butter is around 100 calories. So it does add up very quickly. So we recommend all of our patients to measure their portions, at least in the beginning while they're trying to reduce their calories, because what we think we ate, we actually had 25% more. We're not really good at eyeballing our portion sizes. So we recommend getting measuring cups and spoons, measuring it all out so that you're getting the proper portion. We also recommend eliminating all sugared beverages. That's one of the quickest and easiest ways to reduce calories and reduce sugar in your diet, is to eliminate regular sodas, juices, lemonades, sugary coffee drinks, and trying to stick with mostly water, unsweetened tea, flavored waters, sparkling waters, so that you don't get the added sugar and calories. We also recommend all of our patients to keep food and activity journals, especially our patients with diabetes. It's very important that they keep track of not only their blood sugars and what their numbers are, but also what they're eating, so that we can identify trends in how food affects their blood sugar numbers. So just keeping a journal, pen and paper is fine, or they have electronic journals you can use online, like MyFitnessPal, which allows you to keep track of what you eat a little bit more easily. Okay, so the benefits of keeping these journals is that it keeps you accountable, it identifies your eating triggers, and then your trends in your habits. The other important thing to remember is that you want to monitor your weight at home and self-monitor on a weekly basis. Pick the same day and time every week, use the same scale, wear the same clothes, be consistent with your weigh-in. But it's really not feasible to maintain a healthy weight if you don't know what your weight is and what the trend is over time. So at least once per week, we recommend our patients to weigh themselves, write it down, and then that's another way we can keep track of their progress. The other part of living a healthy lifestyle and preventing diabetes is increasing your activity. We have to move our bodies, we have to burn calories. So what are the benefits of exercise? Well, I always tell patients it's like free medicine. Exercise lowers your cholesterol, your blood pressure, your blood sugars. It helps you sleep better. It elevates your mood. It reduces stress. So everything that you could potentially take a prescription for, exercise could help with. So there's so many wonderful benefits of staying active. It's something that we really have to put more focus on. As far as activity goes, we need two types. We need dedicated exercise, and then we also have to have an active daily lifestyle. So we have to have two components. Dedicated exercise is exercise with intention. That means you meant to go out for a walk. You meant to get on your bike and go for a ride. You meant to go swimming at the club. You meant to take your exercise class. It's intentional exercise. Studies show that we need at least 150 minutes per week of brisk exercise to prevent diabetes and chronic health conditions and help us to assist with our weight loss. So 150 minutes a week could look like any of these increments broken down on the screen. Even if you did 10-minute increments 3 times a day, 5 days a week, you would still get 150 minutes. And the nice thing is, no matter which one of these you choose, the benefits would be the same. Whether you did 30 minutes at once or 10 minutes 3 times a day, the benefits remain the same. So what is brisk exercise? In order to get the best benefits from your activity, you want to fall between the 4 and a 6 out of 10 in that green section. You want to be at a moderate activity where you're breathing heavily, but you can still talk and hold a short conversation. You want to still be somewhat comfortable, but becoming noticeably more challenged. So the other thing, in addition to the brisk exercise, is we also have to be fairly active. Our culture has become very sedentary, and you can see from this little picture, as our TVs have gotten skinnier over the years, we have gotten larger because we're spending a lot of time in front of screens and not enough time being active and moving. So it's not enough to just exercise for 30 minutes and then be a couch potato the rest of the day. There's still negative repercussions to that type of lifestyle. So we want to move often and break up the amount of time that we're sitting. One of the ways to monitor that is by wearing a pedometer. So a pedometer could be a small device that you purchase that sits on your waistband of your pants, or it can be in the form of a watch that you wear on your wrist, or they sell them that go around the neck on a little necklace. But a pedometer records the number of steps that you take every day, and it gives you an idea of how active you are. Especially now with COVID, since we're not doing as much and not running around and doing our errands, we're home more, we really took a dip in our daily activities. So a pedometer is a nice way to remind us to move more. Every 2,000 steps is about 1 mile, and the gold standard has always been about 10,000 steps a day. But we now know from additional research that if you're getting 6,000 to 8,000 steps a day, that you're living a fairly active lifestyle. The average person who's pretty sedentary gets only around 3,000 steps a day. So we have to do a better job of increasing our activity, taking more steps, and these are just some ways that show you how you can do that. Just taking the stairs, parking further away, getting outside and doing housework, doing yard work, mowing the lawn. Even if you're working from home and you're on a computer all day, taking movement breaks every hour to get up and take a lap around the house. This all helps, and this all breaks up how much time we're sedentary. The best way to beat exercise boredom is to have a buddy, have that accountability partner who might be able to walk with you, maybe watching TV or listening to music or a podcast while you're exercising. Try a new route on your walk outside, and then maybe try a new class. We really have to have variety, because just like you would get bored of eating the same thing day in and day out, you would also get bored of doing the same activity day in and day out. So how can Edward-Elmhurst help you prevent diabetes? So Jumpstart Your Health is our diabetes prevention program, and it started in 2005 when we acquired a generous grant from the Lions Club, and we worked together to develop this program to help people in the community prevent diabetes. This program is recognized from the Centers for Disease Control, or CDC. It's a structured year-long program with trained lifestyle coaches to help promote healthy eating behavior change, stress reduction, and increase in activity. The goal of the program is to prevent the development of diabetes in those who are at risk. So our participants are people who have pre-diabetes or who have significant risk factors for diabetes. One of the best things is this program is an adaptation of the research studies that I spoke of earlier. So it's an evidence-based program and has an evidence-based curriculum, so we know that it works. We meet in 1-hour group classes, and now of course we're meeting virtually due to COVID, just like this, we're meeting via Zoom. The classes meet every week for 2 months, every other week for 4 months, and once a month for 6 months. There's 22 total classes over the year, which gives people a lot of accountability and support to make lifestyle changes and then maintain those changes. We talk about all different things. We have topics ranging from nutrition and food and diet and exercise and physical activity and behavior change and stress management, how to break old habits, how to create new ones. And then the other nice thing is it's a group. So you get a lot of nice support from the other participants who are trying to achieve, the very, very similar goals as your own. These are just some example of the class topics that we talk about. We have a nice variety of sessions. Our goals for our participants is just like the research study. We want our participants to lose 5 to 7% of their weight, build up to 150 minutes of exercise, and most importantly, prevent or delay the onset of type 2 diabetes. So candidates for this program are those who are at risk for diabetes. You either have pre-diabetes or several risk factors. Not a candidate if you already have diabetes. We have a wonderful diabetes learning center where you can have education there that is more tailored to people already living with the disease. So your commitment in the program is the attendance in class, the group participation, and then of course best efforts towards weight loss and physical activity goals. You will get out of the program what you put into it. These are just some former participants in the program. This is a gentleman who lost 87 pounds. He reversed his pre-diabetes in the 1-year program. This is a lady as well who was diagnosed with pre-diabetes, and after the program, she was down 21 pounds. Her cholesterol went down. Her A1C was normal. This is Rick. He did our program for the 1 year, and he lost over 150 pounds. So this was our biggest weight loss loser so far. He did an amazing job. And Jan, she's 77 years old. She was pre-diabetic when she started. She met her 7% weight loss goal, and she reversed her pre-diabetes and dropped her triglycerides. So really nice benefit. The program does have a fee starting in January. We were very lucky to offer this program at no cost for almost 5 years due to grant funds that we had. Our grant is currently over, so we are charging a fee for this program. It's $249 for the year. It includes those 22 educational sessions with the dietitian, all of your supplies and curriculum. So for the 22 classes, it's about $11 a class is what it comes to for the $249. So what's the next step? So if you feel like Jumpstart might be a good option for you, you could always call us and get more information. We're having new virtual classes coming in January. If you already have diabetes, like I mentioned, we have a wonderful diabetes learning center at the hospital. And a lot of people with diabetes never ever are sent to a diabetes center. But it's a really nice hidden gem because there's diabetes educators that can help you with meal planning, carb counting, blood sugar testing, managing your medications and injections. And if you are on Medicare and newly diagnosed diabetic, you get 10 hours of diabetes education covered if you're newly diagnosed or you're newly enrolled in Medicare. You get 10 hours. And then after that, you get 2 hours per year of follow-up education. Okay, so that's huge. That's a Medicare benefit that most people with diabetes never take advantage of. So if you're interested in diabetes education, you can have your physician write you a referral to go to the Diabetes Learning Center, and you can see an educator. The other thing Medicare covers in your first year of diagnosis with diabetes, they cover 3 hours of medical nutrition therapy with a dietitian so that you could have that one-on-one time to talk about meal planning and how to eat for diabetes. And then every year after that, they offer 2 hours of medical nutrition therapy with a dietitian. So these are two great options. If you already have diabetes and you're looking for more support and education and how to manage your disease over time, Medicare does have these hours waiting to be used. So really take advantage of that. Call your Medicare, talk to your physician, see if you can get that referral, and come to our center. We also have support groups for diabetes. So people who are living with diabetes, we have monthly support groups for those to come together and share ideas and support each other on their healthy journey. All right, so our Diabetes Center is certified by the American Diabetes Association, and I've included the number here if you wanted to give it a call. Again, there's a lot of nice benefits for Medicare beneficiaries if you have diabetes. Okay, and with that, I'm going to conclude my seminar and open it up for questions.
Thank you, Julie, for the outstanding talk, packed with so much information. I hope our BAGC members will take advantage of the information that is provided. At this point, normally we open up in a live session a program to all the audience who can ask questions to the speaker and get more clarification, more information as needed. But when you are doing it virtually, it's not always possible. So just to simulate the same experience, what we have done, we have requested our BAGC members to send some of the questions on this particular topic that they would like to get more information from Julie. So with that, I'm going to ask not all of them, but some of the questions that I received from our members. So the first question, Julie, is there is a high incidence of diabetes in the South Asian community. Mm-hmm. Do you feel dietary issues are the main culprit?
Yeah, so as I mentioned earlier, 60% of the diabetes cases worldwide are from Asia, which is, pretty astounding when you hear that number. And looking into that in more detail, they are seeing changes in dietary patterns over time, including more refined carbohydrates, so white flour products, more animal fats and meat, decreased fiber intake, decreased vegetable intake, increased amounts of white rice, And just like the increase in urbanization leading to more toxins and pollutants in the air, and just physical activity, more sedentary behavior, it's a multitude of reasons. And they're also seeing that obesity in these parts of the world are also increasing. So I think a lot of it is lifestyle.
Thank you. Next question came from another member of our Bengali Association of Greater Chicago. I know exercise dramatically drops the blood sugar or blood glucose level within an hour. Can you tell us the best time to do the exercise and how long the beneficial effect will last in our regular daily life activities?
Sure. So when you exercise, no matter when you exercise, it will have effects on your blood sugars for over 24 hours. So there's going to be a benefit no matter what time of the day you do it. But to get the most bang for your buck, we recommend that you try to exercise 1 to 3 hours after a meal when you have diabetes, because after you eat, within 90 minutes, your carbohydrates turn 100% to sugar in the blood. So exercising between 1 to 3 hours after you eat is an effective way to help reduce your blood sugars.
Thank you, Julie. The next question came from another member of BAGC. A person has normal weight according to the height weight chart, but is affected with type 2 prediabetes or diabetes. Can that person be benefited from your DPP program alone without any medication to control the diabetes?
So that's a good question. Sometimes people will call and say, I've been diagnosed as pre-diabetic, but I'm not overweight. My BMI is normal. Would I still benefit from the program? So for those participants, we don't encourage the weight loss component, but we do focus on the increase in activity and also the change in the quality of the diet and refining their food choices. Research shows that lifestyle change is still effective for diabetes prevention in those who are non-obese. So those who have normal weight and who are pre-diabetic, lifestyle change is still an effective manner for preventing diabetes, even in those with a normal BMI.
Thank you. The next question came from another member. This is a rather little long question. Throughout one diabetic patient's life, food, drug, and exercise should be changed for effective diabetes control. What resources are available for general public to cope with the changes as the patient ages?
So that's a good question. And that's why at the end of the presentation, I discussed the Medicare benefits, because so many people don't know what they're eligible for. But again, a newly diagnosed person with diabetes or a new enrollee to Medicare gets 10 hours of diabetes education that first year. And then every year thereafter gets 2 hours per year. And they get that medical nutrition therapy, 3 hours the first year and 2 hours thereafter. So that gives them a few hours a year where they can sit down one-on-one with a diabetes educator and or a dietitian and sort of meal plan, talk about the changes in their activity and the changes in their diabetes medication. So over their lifespan, so as they age, every year going back and making these appointments to see what kind of follow-up, what kind of changes they might need to make. I think that's probably one of the best ways that people can get their education.
Very good, thank you. Next question. Recently, medical establishment lowered the blood glucose level, which made a large number of population diabetic. It is kind of confusing for general public. Can you tell us something about it?
Yeah, that's true. So in 1997, the ADA, or the American Diabetes Association, they lowered the diagnostic criteria for one to be diagnosed type 2 diabetic. So for example, it used to be prior to 1997 that somebody who had a fasting glucose greater than 140 was considered diabetic. And now it's been lowered to those who are greater than 126. are now considered diabetic. So of course, doing that, we're going to capture and diagnose a lot more people with diabetes who, prior to 1997 were not considered diabetic. These changes are frustrating for people because they also from time to time, they'll do this with the blood pressure recommendations. They'll continue to lower them or make them more stringent. But from what I read, these are based off of research studies and what they find is most effective. And, we know that insulin resistance takes place years and years before somebody's diagnosed with diabetes. So I think they're just trying to capture people earlier in their disease process. But yes, they have the diagnostic criteria has changed.
Thank you, Julie. And the last question, I'm looking at the time, I have to be sensitive. The last question that I'm going to read from our members. Where do you get the A1C test done? Is it readily available? How often should you do the test? And is it covered by insurance or Medicare?
Okay, so the A1C test is done either from a laboratory or some doctors' offices have what we call a point of care test where they would do a finger prick. And with that one little drop of blood, they'd be able to run an A1C. Medicare Part B covers A1C twice a year if you have risk factors for diabetes or if you're already diabetic. Medicare Part B covers twice a year. And that's really all that you would need to have this done is maybe just twice a year, because an A1C measures your average glucose over 3 months. So there's no advantage to running the test less than every 3 months. Most people have it done twice a year. Normal insurance, again, every insurance is different. It has to be validated by a physician. It's not a routinely drawn test, but if you have risk factors, family history, overweight, elevated blood glucose, it would be indicated to check an A1C. But yes, Medicare twice a year if your doctor determines you're at risk.
Julia, thank you so much for all the information. I'm sure our membership will appreciate. At this point, I want to express my sincere thanks to Julie for coming second time to our organization with your valuable time and valuable information. So on behalf of the BAGC, I really appreciate and thank you so much. Also, I want to thank the Elmhurst Edward Hospital group for sending us number of valuable speakers over the last few years for our organization. We really appreciate supporting us in getting the valuable speaker on different subjects. Also, I'd like to acknowledge the help from the executive committee of our BAGC, particularly 3 gentlemen who are here with us, our president, Jayanta Mukherjee, our 2 technical experts, Devashish Chatterjee and Bhaskar Chakraborty. Without your technical help and encouragement, this program, pre-recording particularly, would not have been possible. And last but not the least, I want to thank you, the BAGC member, for your active participation and listening to the programs like this. Without your active participation, there won't be any seminar program. So keep listening, join. We have a number of other programs that are in the pipeline. We will be sending at appropriate time information. At this point, I want to invite our president, Jayanta Mukherjee, to say a few words. Jayanta, please.
Hello, good evening, everyone. Thank you very much, Julie, for giving us an awesome presentation and with your time and effort. It was really, really nice. And many thanks to you for coming over. And Deepakda, thank you very much for organizing all these things. And thanks to Bhaskar, Devashishda, our team, and hope this kind of webinar will make our membership aware of a lot of things which we are not aware. And thank you, Julie. Thank you very much for coming over.
That concludes the formal presentation. Once again, thanks everyone for joining. We have number of future program that, as I mentioned a few seconds ago, on the pipeline. So please keep listening and take care of yourself and your family. Namaskar.